I first want to start, there was a lot of people that have been working on this issue at the national and state level, and I want to acknowledge them. I know the Department of Defense is here, CSG, NASW. Locally, we have University of Washington, Department of Health. So there's a lot of entities that have really been creating the bill that's in front of you. And so why is it needed? Well, we've always had, our families, all of us have been impacted by mental health, but we've seen a lot of increases since COVID. And we have a much higher percentage of adults experiencing anxiety and depression, but also our youth. And one of the things that really struck me with the youth is that the stats are telling us that over 50% do not have access to care. And that's deeply troubling, right? Because we know we have this high suicide rate in our youth, and those numbers have gone up, especially for youth of color. So the bill before you really is an attempt to make our workforce more robust. And I'm, of course, very partial to social workers. I'm a social worker. But, again, we want to make sure that we're streamlining a process. And so we want people to be able to come out of state into our state and practice. One example would be 988. We did a great job in our state. We almost tripled the number of people at the call centers, and some are remote, right? So that's an example of someone who's working remote in behavioral health. Something near and dear to my heart is supporting military spouses, and I know that's really important for you as well. And we have a lot of spouses that are MSWs, and again, we want to streamline that process so that they can be active in our state. There's one thing I want to make you aware of that has made the journey of this bill more complex, and you may hear about it today, is there's a test that has to be taken, and this is currently in place at the national level and the state, which has been found to be racially biased. And so there's different pass rates based on race, age, and primary language. And so there's a lot of work being done, and you'll hear about it probably from Department of Health to come up with an alternative to the test. So one of the things I thought is, do we move forward on this now? What are the pros and cons? Well, I think one of the benefits of moving it this year is that gives our state a place at the table. And that's where they're going to be talking about alternatives to testing where we can really weigh in. So again, I really appreciate your consideration, and I think we all want to see a more robust workforce, and hopefully this will help. Thank you.